a very brief remarks on the state of play in your sector, and then some questions.
Thank you. Kia ora koutou, and thank you very much for the opportunity to talk with you today. We represent 34 hospices across the country, providing palliative care free of charge for our communities. Our services support around 20,000 people and their whānau every year through a team of 750 clinical staff across the country. Of all the people who die in New Zealand, 1 in 3 is supported by hospice. About half of the cost of providing our services is funded through central government via DHB contracts, and we raise the remaining of funds. That's more than $18 million a year through the generosity of our communities. This is both through fundraising and through retail. We have 125 retail shops across the country, selling second-hand goods and staffed largely by volunteers. But turning to the COVID response, hospices were well prepared with pandemic plans in place, and they had considered the worst case scenarios, and also many hospices were involved with localised planning across DHB, primary and aged residential care to ensure a united, integrated response to COVID across the communities. Throughout our response, we work very closely with Te Rūputaki Māori, which is Hospice New Zealand's leadership group, on issues of particular concern for Māori. So over the past weeks of lockdown, hospices have continued to care for people. Our focus has been to try and support people at home where possible and in our inpatient units if required. So like many providers, we have really adapted the way that we deliver care, meaning more phone contacts, more virtual consults and check-ins with carers and people within the patient's bubble. But where needed, staff have visited people at home, taking the necessary precautions. We've maintained our important specialist links with our colleagues across residential care and primary care. But probably one of the most important things that we have focused on is to provide support, information and resources for family carers. And you know, this has caused real stress for whānau, but also for staff who haven't been able to work in their normal hands-on way. But we've tried very hard to mitigate this through technology. There was a real appreciation for why social distancing was so important, but it was very. We've worked national resources for health professionals, both here and overseas. There's been some real challenges and heartaches for patients and families, as well as for the hospice staff, as I've mentioned. Real struggles with limitations around visiting, tangi and funerals, and we've heard about that so eloquently today. And this was a real concern for Te Rūputaki Māori, our Māori leadership group. We're relieved now to be in level 3, and this allows more than 10 people to attend tangi and funeral. We were also very relieved when restrictions were eased and family from the same bubble were able to accompany their loved one to the funeral home. We do believe that bereavement support is going to be essential for people who've been unable to hold the funeral they would have liked for their loved one. And so we need to think very carefully about that moving forward. There is no doubt, as a result of the pandemic response, the hospice sector, like many sectors across the country, has faced significant financial challenges. When we moved into level 4, all of our hospice shops closed down immediately, and many fundraising events were cancelled. And just as I've mentioned, these activities contributed more than 50% of our costs of delivering care. So the majority of hospices have accessed the wage subsidy, and we're very grateful for that. But many hospices are having to use their reserves to cover the additional shortfall from the loss of fundraising and retail income, and this may continue long term. We have estimated that hospices could lose almost 19 million over the 3 months from the lost retail and fundraising income. The wage subsidy covered a good portion of this, but there's still a shortfall for hospices to meet. The Ministry of Health are very aware of the situation, and we are working with them to find a way through this. So looking forward, we're now working with hospices as they plan and budget for the next financial year and consider different options to respond to the lower levels of funding, the uncertainty of cash flow, and new ways of working in this COVID environment. I've heard from chief executives that they're considering a variety of scenarios to reduce expenditure, and their service respondents will be dependent on how funding issues evolve over the coming weeks. So this includes questions around how fundraising will recover long term. What will the demand be for retail shops in the future? Will there be a volunteer workforce willing and able to work in them? In summary, we think the hospice sector has coped well during the lockdown period. While some hospices have changed the means of delivering care, our services have continued unabated during the crisis, and we've continued to care for people who are dying and their whānau. Where there are some questions as to how we recover financially from the COVID crisis, and we're hopeful that our constructive discussions with the Ministry of Health will result in long-term sustainable funding. Thank you very much for the opportunity to talk with you today, and I'm very happy to take your questions.
Thank you, Mary. We really appreciate having you. And as we have with others, thank you for your service and those of your members around the country. I know in my neck of the woods what a great job Waipuna Hospice does. Just on the restrictions that you've faced, you talked about them being eased. Are you now in a situation where you are back to, in quotes at least, normal?
No, we're not. We're still working under the level 3 lockdown. But still we're doing a lot of our work remotely, but we're needed. We are making visits for people at home, so not normal as such yet. The provision of our care continues, however.
Right. What does it mean for the care for your patients or clients?
Look, I think it's been a very difficult time. Hospices have had to be very resourceful in terms of how they support patients in whānau, and they have done that through the use of technology. But look, we're needed because we're an essential health service. Medical staff and nursing staff have visited patients and seen them face to face. So it's meant that we've had to work in a more creative way and have been very resourceful to support patients and whānau. And I think we've also, of course, our inpatient units have still been operating. So, but the real challenges have been for patients and whānau in terms of people who can support them and who can be with them at this very difficult time.
Thank you. Marama Davidson.
Morena, Mary. I'm very pleased to hear from Hospice this morning. Far out, it's all really difficult. I think I'm sitting here with a lump in my throat through this entire presentation and all of our submitters this morning. I've heard about the funding struggles, and I know, for example, that the hospice shops around the country provide a big part of your funding, and of course they haven't been able to operate. So I wanted to give you an opportunity to talk about the sort of funding makeup that those hospice shops give. And I'm aware that despite my constant contribution to those amazing shops, we need to think about systemic funding as well. But I just wondered if you could give us an idea of the sorts of contribution that those hospice shops help out with the work of hospice around the country.
Yes. So last year we received $49 million from the hospice shops. And the reason why we're able to be so successful is because we have people kindly donate all their goods. And of course, we have volunteers who work in those shops day in, day out. So they are, for some services, they are the crucial income stream, up to nearly 50%, and some are even over 50% of income from the retail stores. So with level 4 and the shops closing, that was an immediate drop in income. So yeah, a real issue for us moving forward.
Thank you. I hope we can continue to think about how we provide the support in light of that. Can I move on to, thank you for mentioning Te Rōpū Taki Māori, and obviously the Select Committee should consider hearing from them directly. Through COVID, what have been the ways that hospice has worked specifically with the leadership of Te Rōpū Taki Māori through these times? Have there been any specific discussions or plans that you would like the committee to hear about at this time? Because how can, I'm thinking about how can we as Parliament and government work better with our Māori leadership groups across different sectors. Perhaps we could get Ria Earp, your chair, I believe. And
she's the chair of Te Rōpū Taki Māori, exactly. She would be I think that would be really helpful. Look, I think the concern that our leadership group had was very much around the visiting and around being with whānau, after the loved one had died, in terms of the body. So those were the to journey with their loved one, not being able to have tangi, and our advisors were very worried about that, and so we've discussed that. So visiting, the care of someone after they've died, and the support for whānau were the key issues. And we certainly, through RIA, had input into the ministry guidelines, and also RIA also was connected into the Māori Epidemic Response groups, leadership groups. So really important, I think, moving forward to acknowledge how important this has been and the impact on Māori.
Thank you very much for your time. Thank you, Mr. Chair.
Thank you very much. Mary, we just really appreciate once again the work you and your members do, and we acknowledge what a difficult time it is for both those you help and also your workers who put themselves out there at a time when so many have obviously been in lockdown and at home. We also acknowledge those funding issues you've raised, which are very real, and you know, I think your case highlights quite clearly that the difficulties there will be for essential community services where your funding is, you know, some government, but much of it off the sweat of your own brow fundraising. And as we're in tougher economic times, of course, that's going to be a real difficulty. So I'm sure the committee will all be thinking about that and watching that with interest. We appreciate your time, and